all of the community here has been very supportive of wanting everything that I bring to the table.
We have a lot in common in the sense that we all want to affect change or be a part of change, specifically in the health world.
Well, I'll tell you, the students that we have here are very motivated.
The reason why I got into sewers is because this is such a common spot for our public health efforts to control things like West Nile virus. It's great to come to work and you just enjoy the people you work with, and that includes the students.
I, during undergrad, spent a couple of summers working for nonprofits doing relief work overseas, and through that I saw that health really does have a big determining factor on people's overall quality of life, their ability to get education, have jobs.
Dr. Luke speaking about her international study really struck a chord with me. That's how I actually started at Loyola as the project coordinator for this big 5-country international study.
The social justice component is special for Loyola's Masters in Public Health program because Loyola itself has values in social justice. So I think Chicago is very easy to visualize the health disparities that exist, and people living on the south side are faced with more health disparities than people on the north, which I just think is unfair.
In my family, someone in my family has had cancer, so that's why I wanted to do research in cancer among Hispanics. What I'm finding about this program is that it's culminating everything that I developed in the first year, and I'm using all of those skills that I've built to do the research and do a good collection of the data and then being able to analyze it.
This is an environment where the mathematics gets application.
He adds another layer onto it with the stories that he tells us about how it could affect your family member, it could affect your spouse.
Statistics is not going to save lives. Statistics is going to provide the means for you to think about how to save lives. That's the issue.
We have group projects where we have students with various backgrounds working together. That's going to help prepare them for future public health practice.
I'm from New York, so diversity is a very big deal for me. And I see that here for sure, and not just in terms of like race and gender, but also just in terms of like mindset and like lifestyle. Everyone's very different in that sense too.
Working interprofessionally on teams is becoming the norm. We've designed our program so that students who are working full-time can complete our program. Most of the classes that are offered are either offered in an online setting, or if in a traditional classroom, they're offered in the evening.
I'm very passionate about research. I'm very passionate about serving underserved communities. And so the MPH was a way for me to better serve in both of those roles as a researcher and someone who can advocate for voiceless groups.
And so seeing the barriers to access to care that those people experience on a daily basis was really frustrating.
When I came to Loyola, I really felt like who I was in all aspects was wanted here, and that was going to make me a better public health professional